I'm John Burroughs, President and CEO of the Burroughs Healthcare Consulting Network, and I'd like to talk to you briefly today about moving peer review from quality assurance to performance improvement. As most of you know, quality assurance came out of the industrial era when somebody in a white jacket would walk along an assembly line, eliminating defective products. We've been doing that to this day in peer review, asking ourselves the question, what did the doctor do wrong? And if we find something, we typically either slap them on the wrist, which accomplishes nothing, or ask them to attend a CME course. Is there a more constructive and positive way to do peer review? I'd like to give you a four-step approach to consider. Number one, understand how a quality assurance approach has undermined the medical staff's ability to perform rigorous and thoughtful reviews. When you ask yourself the question, what did the doctor do wrong, rather than how can we help the doctor or doctors do it better tomorrow than we did it yesterday, that's an entirely different question that drives an entirely different outcome. Ask yourself the question, how many measurable improvements have we instituted this year because of peer review? Many of you will say very few. Number two, create a criteria-based peer review system based on mutually agreed triggers. For instance, we want to look at all sentinel events, or we want to look at rates and rules, which is a way of aggregating data based on a predetermined benchmark or threshold. Number three, when issues are discovered, focus on measurable improvement opportunities and not on sanctions or corrective action. If what comes out of peer review can be a measurable improvement, then physicians will feel good about the work, management can feel good, and the board can feel proud. And finally, number four, publicly communicate and celebrate improvement initiatives. What should come out of peer review is a spreadsheet with all the wonderful improvement initiatives you've not only accomplished, but can demonstrate to the public at large that because physicians cared enough to review each other's work, they have better care, better outcomes, and a better organization to go to.